Welcome to a special three-part series of highlights from the Pennsylvania Mountains Rural Health Conference that was held on November 16th, 2023 at Indiana University of Pennsylvania. I'm your host, Dr. Jim Kinnear, Chief Human Resources Officer at the Indiana Regional Medical Center. We'll be sharing some highlights from the conference where over 200 participants gathered to learn and exchange ideas about rural health care, including workforce shortages, barriers to care, and funding models. In this podcast series, we'll be talking about some of the presentations given by key individuals that address topics such as healthcare workforce recruitment, finances in rural communities, and developing training methods for new healthcare practitioners. Our guests in this episode are Ms. Bergitta Cotroneo and Dr. Ben Frederick. Ms. Cotroneo is the Chief Executive Officer and Executive Vice President for the Alliance for Academic Internal Medicine. In her presentation, Ms. Cotroneo discusses the pathway concept that focuses on opening more opportunities for potential healthcare workers. Dr. Frederick is the Director of the Global Health Center and the Director of the Pennsylvania Area Health Education Center. He is also the Dr. Klein Chair for Humanistic Medicine and a Professor of Family and Community Medicine at the Penn State Hershey Medical Center. His presentation highlighted the problems of workforce recruitment in rural areas, as well as the idea of systems thinking and what we can do to improve systems already in place. Join us as we discuss these issues with Ms. Cotroneo and Dr. Frederick. To get started, I was wondering if you could just introduce yourself and share a little bit about what your role is professionally.
So I'm Bergitta Cotroneo, currently Deputy CEO and EVP at the Alliance for Academic Internal Medicine. We're based in Northern Virginia in Alexandria, but we represent physicians and administrators, faculty members in academic medicine around the country, in Canada and Puerto Rico, chairs of medicine, residency program directors, clerkship directors, the full gamut of the folks you'd find in departments of medicine.
My name's Dr. Ben Frederick. I'm at the Penn State College of Medicine in Hershey, Pennsylvania. A couple of the main roles I wear, I'm the director of the Pennsylvania Area Health Education Center, which is AHEC. That's a statewide organization, and we are really passionate about helping to train, recruit, and retain health professional students for underserved and rural Pennsylvania. I'm also the director of global health at the medical school, which is defined really both by its international component and also its domestic underserved. So those are the two main hats I wear, as well as being a family physician.
Thank you. Today you were talking about pathways, and I was wondering if you could give just a quick overview of what a pathway is.
Sure. So, we think about workforce issues and we always say pipeline. And sometimes if you think about what that would look like visually, it's narrow, it's dark, it's long. A pathway just feels a bit more open with possibilities. I think our students, our medical students, our residents, and our fellows see the world that way. They see the opportunities that they have for career, for service, and for engaging their peers. And so I like the idea of a pathway. You can step off the path for a moment. Take a breather, do research, go volunteer in another country and come back to it and continue on your journey, but you're still serving.
Pipeline gives you the image in your head, I think, of something solid, connects to other places, but what's lacking in a pathway is, what's lacking in a pipeline metaphor is that this is anything but solid. This is very squishy. There are multiple ways to get to the same place. And if anything, the pipeline would have lots of leaks in it, whereas we don't think that's a proper way of looking at it. We think you can get to health professions schooling through a number of different ways, even if you take sort of detours to get there.
And why would you say pathways are important to addressing some of the workforce challenges in healthcare?
Well, one, I think that it allows you to see life through someone else's eyes. It allows you to step into places and spaces that, under normal circumstances, you may have avoided. I always laugh because one of the things that I get to do is travel around the country for professional conferences, and there are cities that I would never have selected on my own. I would not have bought a ticket to go to X or Y. And I go because of business and get there and find out that, oh my goodness, there's architecture and art and music and all these things that I didn't know. It's the same with our students, going out into the world to see what the world is doing, and then bringing that back with you just makes you a richer person.
I think the pathway is a really great metaphor for the process because I think as we've worked on health career areas in our own work here between the university and medical center, we often find that people aren't following that linear path of
Right.
undergrad, grad, right into medical school, that people may take time off and go into different career paths and come in from different areas. So that idea that you can join the pathway at different places is very interesting.
Yeah, I think, when I was an undergrad student, it was all about coming in, do the 4 years, get yourself a job, move on, go to grad school or professional school. Now I think it's more acceptable to consider opportunities that may pay, may not, but all of those opportunities, experiences come back with you as you finish your education and then make some decisions about career. I think it's a bit more forgiving than it was, just 25 or 30 years ago.
It's really conceptualizing it in a new way. Pathways really does start early in middle school. Some will even say elementary school, in introducing students to the very notion that they too can be a nurse, they too can be a physical therapist, a doctor. Giving them that idea up front is really important, not sort of keeping their minds closed to options. And it continues through high school, into college, and then into the health professions careers. It's important to support these students all along the way so that they can still realize their dream, their thoughts, and they don't get too discouraged. They can stay in the pursuit of what they hope to do.
That's a great way of that importance of that experience and really becoming immersed into a community. And I think there's a relevant part of that to rural healthcare. And there's a reason why we want to have individuals come into the rural environment for their experiences. Could you share your thoughts on that?
Well, I think, it's twofold. One would be just coming in and sharing your expertise and adding to the community, adding value to the community, being somebody who is going to come in and share your knowledge and ideas and grow. But the other side of that is that you grow yourself. You meet patients, you meet families, and you find out things that are well beyond whatever, the diagnosis is or what the chronic illness happens to be, because that's not the whole person. The whole person is the woodmaker or the farmer or the person who's a nurse, but now they're a patient, and so that's a completely different perspective for them. So I always like to make sure that when I'm mentoring or coaching anybody, let's look at the totality of the experience as opposed to focusing on that one little thing that we're supposed to do today.
Why do you think that early exposure to the options and the possibilities are important, and particularly in rural areas?
I think they're incredibly important. Rural students, they have a set of challenges that are just different from our suburban and urban students. And I don't think that's been well recognized. I talked about that this morning, this idea that we try to use a one-size-fits-all approach, whether you're urban, suburban, or rural. But rural students really do have additional challenges created oftentimes by their geography. And as a result of that, it takes more effort to get where they need to go. That means more effort needs to be put in up front to help them get where they need to go. And that includes something that for a suburban student or an urban student might be very simple, which is exposure to healthcare fields. That might be right down the road for them. For a rural student, that's going to take more planning and coordination to pull that off. So for these students, they also may not be have people in their friend group, in their family group, in their social group who come from healthcare. That's just the reality of living in rural places like Pennsylvania. There are fewer clinicians, there are fewer nurses. As a result, they're not going to rub shoulders, so they need lots of exposure at an early age to show them this also is a possibility for them where they otherwise might not even have thought about it as a possibility.
Why is it so important to attract more physicians and other health professions into rural healthcare?
Well, that's a great question because the evidence is really overwhelming that people who live in rural places have worse health outcomes. And it's been clear for well over a decade now, the health outcomes are worsening as we go on for a whole variety of very complex reasons. On top of it, the places in the United States and frankly around the world that are in most need of healthcare personnel are rural places. They're chronically understaffed. They're chronically in need of more people to come out and do the work. So this is not going to change. The issues in rural Pennsylvania are not going to change. The trajectory doesn't look good. There's a widening of mortality rates between urban, suburban on the one side going down and flattening on the rural side. And that gap is widening between those two geographies. Physicians, nurses, nurse practitioners, all of those clinicians are necessary as an essential part of the health of the community. So unless we invest in our rural communities and do it in a wise way, those gaps are just going to continue to widen.
Thank you for sharing that. As we think about how do we address some of those gaps, in your presentation, you talked a bit about systems and structures, and I was just wondering at a high level if you could share some key points from that.
Sure. So a lot of people actually are now thinking about systems or systems thinking, how to sort of imagine how a decision you make might have impact beyond your immediate decision but have maybe unintended consequences. That's a way of sort of systems thinking. So we're becoming more facile with considering systems thinking. We all work within systems. Systems I define as organizations, businesses. We may be in school. That's a system that's at play with many different kinds of systems pulling it off to make it happen, whether it's finance systems, auditing systems, and so forth. That's at the one level. Kind of sitting above systems then are the structures that give shape to the systems. They can constrain the systems and tell them what they can and can't do. So an accrediting agency, for example, that's for a university, would have guidelines or policies or requirements for the university. That would be a structural component saying if you want to stay accredited, you have to meet these benchmarks. So structures are really laws, policies, but they can also be positive things. They can be incentives. So if you want a set of systems to do something, you can motivate them through different incentives. So that's how structures and systems relate.
Thank you for sharing that. And you made a reference to this earlier, but I think one of the really powerful things that I took away from your presentation today was talking about the difference between equity and equality. And just wonder if you could give a quick comment on that as well.
Sure. I don't know if my comment will be quick because I'm passionate about this one. Equality is everyone gets the same. That sure sounds right on face value. That seems correct. But when it comes to issues like health or healthcare access or pursuing healthcare professions, you quickly find out that's inadequate. Providing everyone the same is not actually going to work, and that's what we have been doing in the United States and in Pennsylvania, and we're getting the kind of outcomes as a result of that intervention, an equality-based intervention. So everybody gets the same thing is the same thing as saying there's an image from the Robert Wood Johnson Foundation that I showed that you can find online, and I think it illustrates things very, very nicely. But in short, providing someone who does not have legs, who has that physical disability, with a bicycle, and providing me with a bicycle, maybe providing the same exact thing, that's equality, but it's not a fair intervention. It's not going to help the person who doesn't have legs. That may sound dramatic, but that's essentially what we're doing. So equality is everyone gets the same. Equity, people get what is tailored to best maximize the opportunities for them. So equity requires more resources. It requires that everything is customized and tailored to the group or the individual in a way that equality doesn't work.
Thank you very much for helping us to better understand that distinction. I just want to thank you for your time today as a presenter of this conference. Your presentation was very insightful, and also just for taking the extra time to share some highlights here with us as part of the podcast.
This has been my pleasure, and I'm really so happy that IUP is being part of this process and IRMC and really leading the way in issues of rural health and rural healthcare workforce.
And that concludes today's episode of Rural Health Pulse. In our next episode, we'll be featuring more highlights from the 2023 Pennsylvania Mountains Rural Health Conference at IUP. The Pennsylvania Mountains Rural Health Conference is a forum for rural health leaders and providers. The 2024 conference will be held on Thursday, November 21st at Indiana University of Pennsylvania. Please visit the conference website at pmrhc.org for more information on future conferences. I'm Dr. Jim Kinnear, and thanks for listening to today's Rural Health Pulse.